Hello?
Okay, hello everyone, welcome. And Chief, your camera might be better if you rotate it the other way.
Pardon?
I said your camera might be better if, okay, let's go. We're going live in a short time. We have
My
only
work
one.
with camera.
You're okay. You're okay the way you are.
Okay.
Okay, let's turn down the music.
Gonna no vex. So I may have to put off my mic because I don't know. Should I turn it
Mhm.
off? Oh shit.
Okay, so everyone, you are most welcome to the Marjorie Bash Health Show, and my name is Dr. Kelechi Eguzo, and with me here, we've got a very power-packed crew to dive into the topic of discussion. But before I go forward, how is everyone doing today? If you are watching us live from on Facebook or anywhere, just go ahead and show your thumbs up, and let's see where you are watching us from. Okay. Okay. So that is how today is going to roll. We have Dr. Timothy Ekwere here on board, and we're just going to meet our guests very soon. But before we go forward, I just want to let you know that you are live on Marjorie Bash Health Show, where we discuss health and wellness. And you are more than welcome to go to Facebook Live and send your messages, your likes and comments, and we'll be happy to show them on the stream here. And then we can also have to answer your questions that way. And so, Dr. Query, can you let us know, tell us who you are and what you do?
All right, thank you very much, Dr. Eziogo. You have already introduced me. I'm Dr. Timothy Ekwere, consultant hematologist, and majorly I see and manage patients with blood and blood-related diseases, various forms of blood and blood-related diseases. I work with the University of Uyo Teaching Hospital as a specialist consultant. I also work with the University of Uyo as a lecturer and associate professor in the Department of Hematology, where I'm involved in training of medical students as well as postgraduate students in hematology. And of course, I render community service, which is part of what we are doing today. So in a
Wow.
nutshell, that's all.
We are very delighted to have a man that wears many hats, not just many hats, but many important hats in the community. You're most welcome here, Dr. Ekwere. And the other person that's joining with me here, who is running our works in the background and making sure that you can hear us, you can see us, and all of that stuff is Dr. Becky Brown from Marjorie Bash College of Health and Technology. And myself, my name is Dr. Kelechi Eguzo, and I am a family physician. I work with different patients who have different conditions from headache to cancers. And sometimes I happen to manage people who have health conditions like hemophilia, which I really haven't seen very much of. So today's topic is about hemophilia. Around the world, many people have a condition where they just tend to bleed. I don't want to jinx it, but I'm just going to ask Dr. Ekwere to please tell us what is hemophilia in a layman's term.
All right. I'm sure some of our listeners will have heard the term hemophilia. And in simple term, hemophilia is an inherited bleeding disorder. What that means is that generally when any person, okay, sustain injury, any form of injury, we tend to bleed. But usually after a while, with pressure applied over the surface of the bleeding, after between 3 to 8 minutes, the bleeding is expected to stop. For this very group of individuals with these rare conditions, they tend to bleed profusely despite all forms of pressure applied to the injured area. they will continue to bleed except there is medical intervention. They may bleed and bleed out entire blood volume. Okay, and that is could be life-threatening. So in a nutshell, it's an inherited condition in which an individual is unable to control, that is bleed excessively due to some deficiency of some factors that are inherently present in the blood system of every normal individual. But this group of individuals lack this clotting factor. And this clotting factor is known as factor 8 or factor 9. These two clotting factors in the general population are usually what helps to sustain and maintain hemostasis. When we mean that hemostasis, that's the ability of the body to be able to arrest bleeding when it starts from any form of injury. But however, when you hear that somebody has hemophilia, it means the person is deficient in either factor 8 or factor 9. And as such, when they have injury and they bleed, they tend to bleed and bleed and bleed profusely until there is a medical intervention to stop that bleeding.
Okay, well, that's good to know. I haven't heard the words factor 8, factor 9, and sometimes when I hear factors, it takes me back to mathematics. But what are these factors you're talking about, Doc?
Okay, these factors in every individual, we have in our blood system what we call the clotting factors. These are proteins that helps the body to form clots over an injured area. Okay, so whenever we have injury, in simple terms, these factors, there are about 12 or 13 of them, come together through various mechanisms and reactions with the help of factor 8 and 9, being the anti-hemophilic factors, will come together to help maintain and form a clot over that injured area. We cannot rule out the role of platelets as well. Platelets also have a very important part in forming clots. But basically, when we talk about hemophilia, there are platelets both in function and in numbers. That in function, that's quality, and in quantity are normal. But the problem is this factor 8. They have every other factors. The factor 1, factor 2, up to factor 13. They have all these other factors, but they are deficient in either factor 8, the anti-hemophilic factor, or factor 9, also known as the Christmas factor. And these two factors are those proteins in the body that without them, the individual is not able to form a firm clot over an injured area. And the consequences is that the person continues to bleed and bleed and bleed until there is a medical intervention. Where there is no medical intervention, I can bet you that the person will bleed and bleed until he gets exsanguinated and it's life-threatening, but the person may die from bleeding out his entire blood volume in a very short time. So it's that serious a medical condition. And the awareness needs to be made known to the public, because all around us, we may have seen one or two persons with this very rare condition, knowing a child or an adult that tends to bleed like this. And it's important to advise them to, as much as possible, seek medical attention very fast.
Mm-hmm. Wow, that's very good to know. Thank you very much for delving right into this. I mean, listening to you describe how this, going back to the basics of things like the factors. It takes me all the way back to medical school. Now I see why you're an associate professor. That's very well explained. And so, from what you said, hemophilia appears to be a disease that affects males general for the most part. Why is that?
Okay, like we said, it's an inherited condition, but in this case, it's an X-linked inherited medical condition. X-linked in the sense that this condition affects the X chromosomes. And so we know that for males, for a male child or a male individual, we have what we call the X and the Y chromosome. While for female, we have two X chromosomes. Okay? So the X chromosome in either sex, both male and female, is usually dominant. So the X chromosome is the dominant chromosome, while the Y chromosome in the male is somewhat referred to as inactive or a recessive chromosome. So the pathology, the genetic pathology in hemophilia actually is an X-linked. That means affecting the X chromosome. So because for female, they have a complementary X chromosome. So most time when a female has this abnormal gene on this X chromosome, the complementary X chromosome is able to compensate. And so the disease is not expressed. So in female, they become an obligate carrier. That is, they have the disorder in them, but it's not expressed because the other X chromosome is able to carry out the function of the abnormal chromosome, X chromosome. But in the male, because they have just one X chromosome and the Y chromosome in most cases tends to be said to be recessive or inactive, as it were. So anything that affects the X chromosome is obviously expressed. And so once the spouse, that's the woman who is X, carries the abnormal chromosome, now bears a male child, definitely, and transfers the abnormal X chromosome, that contributes the abnormal X chromosome to the gender of the child now taking the Y chromosome. Then because he's transferring the abnormal X chromosome coming from the mother and the man donating his own Y chromosome, then obviously the child become completely an hemophilia. But on the other hand, if the mother donates her own X chromosome, which is that carries the abnormal gene, and the father now donates his own X chromosome, which means that child is going to be a female, then that child will become an obligate carrier because the other complementary X chromosome coming from the father now that has no abnormal gene, that's from the father is able to compensate, and so the child will not express the disorder, and that makes that child, that female child, an obligate carrier of the disease. So essentially, hemophilia is a disease of the male, while females are said to be carrier. But there are few theoretical circumstances in which a female can also be a carrier, can also be, a sufferer. Instead of being a carrier, there are some few exceptional cases in which a female can also be a carrier. If you permit me, we may go into it or we may just allow that to be. But there are few rare circumstances in which you can have a female hemophilia from genetic basis.
Mm-hmm. Well, thank you very much for going into that detail. I like how you delved into to the roots and trying to show us how a woman is the carrier, but it's the male who makes it be more evident, and that's why it's more common in males. A viewer actually just asked us the question, which people get hemophilia the most? And I believe Dr. Ekwere has addressed that to show that the hemophilia is mainly a disease of males. So, in your experience working at the University of Uyo Teaching Hospital, like how many patients have you seen in the last, say, 6 months, 1 year that have hemophilia? Is it like real in our society, or is it just in the textbooks?
Oh, definitely. There are quite a number of them, though not many in our environment. At the outset of this condition in the early 18th century, it was thought to be a disease of the royals. What I mean, the disease of the royals was disease amongst the kings or the royal families generally, because they practice what they call inbreeding. But with time, science have shown that, look, the disease is also prevalent in the general society, okay, as opposed to what used to be thought of, that, oh, this is a disease that is synonymous with people from the royal family. So in our own practice here at the University of Uyo, we have by and large 6 hemophilias. And surprisingly, these 6 hemophilias are from just 3 families. In one of the families, we have 2 boys, okay, in a family of 4, 2 girls, 2 boys. We have the 2 boys being hemophilia. Then in the other family, we have 3 of the boys. The family also, I think the family of 5, 3 of the boys are all hemophiliac. Then we have one other family, just one person is an hemophiliac. That's the family of 2, I think 1 male and 1 female. And in all of these families, you find that those female, if we can do genetic testing, we may find that those females in those family may be carriers of the abnormal gene. But because they are female, the other X chromosome, like I earlier explained, we compensate, and so they will not manifest the disease as the bleeding tendencies as seen in the male children. So
You
they
know,
are there in the family, but what I would say is that the prevalence or the prevalence in our community is underestimated. Because if we look deeper, if there are available logistics and we go into the hinterlands, we find out that there are many of these children with these disorders, but are not able to access healthcare. Perhaps because healthcare is far away from them, so accessibility is poor. Okay, awareness is also at the lowest ebb concerning many this disorder in our environment. Even at the national level, up to the ministry level of the ministry, it will surprise you that there is no health desk for hemophilia disease. So it's that abysmal when it comes to the level of awareness. So generally, even globally, it is believed that the prevalence is even underestimated, especially in developing climate like ours. Like from the data from the Nigerian Federation of Hemophilia, we have about 300 on the list, about 300 or thereabouts. But it's believed that there are more because we are really not looking out for them, or perhaps facilities are not available for us to really investigate and assess these people and bring them out to assess treatment. And you will agree with me that majority of the children who are born in this country are born outside of the healthcare system. So it becomes even more difficult if the traditional birth attendants are not even aware that there is a condition like this that will even help them, that when they see it, they can refer these children. Because majority of these children are born outside of the healthcare system. So there could be more, okay? But
yes,
what we have
yes.
in our center is just this few that their parents, perhaps being enlightened, been able to see this condition and seek medical help.
Wow, thank you very much for delving into that, because it's easy to think that this thing is only it only affects Oyibo people, or it doesn't really, it's not our portion. Nobody in our area has it, but actually, I'm shocked to see that it's actually live in our society. And if you're just joining us, this is the Marjorie Bash Health Show, where we discuss health and wellness. And the topic we're discussing today is hemophilia. And with us, the guest is Dr. Timothy Ekwere, the Associate Professor of Hematology at the University of Uyo, and a consultant hematologist at the University of Uyo Teaching Hospital. And my co-host is Dr. Becky Brown. Please wave to the audience. Thank you so much, Dr. Becky. Appreciate you. And we'll take a quick break. And when we come back, Dr. Ekwere will talk to us about one, how to find hemophilia. How do we know who has hemophilia? Is there any tests? And next, he will also talk about other questions that the audience will be sending. We'll be back in a couple of minutes. Thank you very much. And stay tuned, okay? Keep sending your questions through the live chat, and we'll do our best to respond to them.
Source. I hope you can see my face. My light source is so low.
Okay, we are all back here again at Marjorie Bash Health Show. Dr. Ekwere, we can see your face very well. Thank you all very much for joining us, and I am very happy to see the questions you guys are sending in. And so, Dr. Ekwere, just to go into the second part of this program, what tests? How do we find this disease in the community? How do people present with it? How do we get to discover it in our local communities?
All right. Thank you for that question. The diagnosis or ability to detect those with hemophilia is most time 90% clinical, right from the clinical history, and it starts at infancy, right from birth. Okay, and this information is particularly important for the midwives or the traditional birth attendants. Soon after the child is born, the earliest indication, soon after the child is born, the child is usually detached from the placenta that connects the child to the mother to the child, okay? Once that placenta is being severed, it's usually cleaned and wrapped properly. The earliest signs you may notice the midwife or the TBA, traditional birth attendant, may notice is that soon after that, applying the normal pressure, they may notice that soon after, the dressing over the umbilical cord area is profusely soaked. That may be an early warning sign. Of course, vitamin K deficiency may also present like that. But you see, the difference is that in our environment, all babies in most of the hospitals, including the health center, are prophylactically given vitamin K injection so as to activate the vitamin K dependent clotting factors, because at that age, the liver is not well matured to start synthesizing the active vitamin K. So giving external vitamin K helps those clotting factors to become activated and they start working, okay? So once vitamin K is given, which is usually done in our environment to almost all newborns, okay? If that was done and then you still notice that 24, 48 hours after, the child is still, the bleeding area is still soaked, that's an earliest indication that something may be wrong. But the more pronounced one is the post-circumcision bleeding. Usually for every male child, I'm talking now of male and newborn. Usually every male child in most societies in our environment here, after 8 days, they are taken for circumcision, okay? So usually after circumcision, generally all the children will bleed, but after firm dressing and all those, the bleeding tend to stop. But in a case whereby after circumcision, the dressing is done and within hours, the dressing becomes soaked, or the woman after that circumcision, they are told to go home and they come back the following day telling you that, oh, the dressing over circumcision is continually being soaked and the woman keep changing it severally. That's in 90% of case. That in most time, 90% of case confirms, apart from you now doing some laboratory tests to confirm that this child is a hemophilia. Most times, post-circumcision bleeding in a male child, hours after circumcision to days, most times confirms that this child, high tendency that this child will have hemophilia. Then as the child grows, child is growing up, The child start crawling, you start noticing that the child crawls with the forehand, the both legs and the hand. You start noticing easy bruising. When the child crawl, those hands and the knee, you start seeing that they easily get bruised. Unlike other children of that age, when they crawl, they don't have bruising. Those are also new telltale signs that yes, this child may be having some form of bleeding disorder. And then as the child starts having tooth eruption, okay, from the milk teeth going towards the adult permanent teeth, as they start having this tooth eruption, normally when the child has tooth eruption, there is mild bleeding, and then after some time the bleed stop. But in these children, they need to see a dentist because they will bleed profusely. So like the last patient we have in my center, the diagnosis was made when the child was about 5, 6 years old during tooth eruptions. Because at this stage, they were not observant, even though the mother gave that history that yes, when they did circumcision, the child bled for a prolonged period, but they didn't take cognizance of that. And more instructively, the child bled and was transfused. So perhaps after the transfusion, the clotting factor from the transfused blood may have helped to correct it. But during tooth eruption, the bleeding was so profuse, and the dentist had to call us that, look, we have this patient who is bleeding profusely. You people should come and take a look. Because at the point, we now had to take back the history. Okay, how was this child? So we now got it, and with some laboratory investigation, we were able to pinpoint that, yes, this child is in hemophilia. At adult age, the child is now an adult, is able to talk and communicate. They also will notice that whenever they have injury, this injury, despite applying pressure over a time, they will continue to bleed, 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 bleed. And then as they grow older, another pathognomic signs of children with hemophilia is that they tend to have bleeding into the joints, especially the knee joints, hemoarthrosis, that we call it, bleeding into the knee joint. That is a classical feature of many adult hemophilic patients who is not receiving adequate treatment. The joint tends to be swollen and is very, very tender, very excruciating. It can affect any of the joints, from the knee joint, which is the commonest, to the hip joint, to the shoulder joint, to even the joint of the fingers. It can affect any joint, but it's more common in the knee joint. So we call it hemophilic hemoarthrosis, bleeding into the knee. And with time, because of the repeated bleeding, the joint may become ankylosed, that is fixed and deformed, and will result in hemophilic knee arthropathy, which is another common features of hemophilia in the developing countries. I say in the developing countries because you won't see these signs that I've mentioned in hemophilic patients in developed clients, because the health system has so developed that these things could be actually, I wouldn't say, would I say prevented, but can be adequately treated such that these children do not present with all these deformities that we tend to see in our patients. So the features start very early, from early stages of birth, and runs through adult life.
Okay, well, thanks for explaining that again, because from what you've said, you've kind of described it that any child who has circumcision and
Male child,
yeah,
male child.
yes, any male child, female circumcision is bad. Nobody should ever think about that. But
Yeah,
that's not what we're discussing today. Any male child, boy, that has that's bleeding after circumcision for a longer time than any other child you've seen, that child does not need to go to the next prayer house. Right? They should go to the next hospital that has a doctor for
exactly.
us to start finding out what's going
Yeah,
on.
it's a
Good. And
high
again,
index of suspicion.
yes, and then
Post
again for parents. So for parents, if your child is at school and their teeth, their tooth came out around that kind 5, 6 years, and they start losing their teeth. And when this child has lost a tooth, they bleed for too long. Don't wait and go and see, let me put this herb or put that herb. Try and go to a hospital and find, let's find out, could this child be hemophilic? Thank you very much, Dr. Ekwere, for really going into those things. And again, this is the Marjorie Bash Health Show, where we discuss health and wellness. And we encourage you to send your questions into the chat, so we will do our best to address them. We are just about winding down the show here, and we want to talk about resources. We have a question here from live chat that said, I'm going to put that here so everyone can see. Okay, so someone asked, are there services for people with hemophilia in Nigeria? Dr. Ekwere, what's your experience?
Yes, there are. There are designated centers in the country in the 6 geopolitical zones where hemophiliac patients are treated. Generally, in most of the teaching hospitals, you have specialists, hematologists like myself, who are versed in the clinical presentation and the management of children with hemophilia. You see, when we started, we said these individuals lack a particular clotting factors amongst the various clotting factors, which is factor 8 or 9. So basically, the treatment is simple: replace what is missing. And science has developed such that these clotting factors are now, there are various preparations. They are like drugs. They are readily available, okay? Not readily available over the counter, but they are available through designated means. And so when you have these clotting factors, you inject into the child, it replaces the normal, natural occurring factor 8 or 9, depending on the deficiency that the child have. So the first thing is to determine which of the factors that is missing, which is what we do. Once you have a high index of suspicion, carry out your test. It will be able to tell you, oh, is this factor 8 or factor 9? And then once it's factor 8 or factor 9, the next thing is to determine the severity. Okay, because you have mild hemophilia, moderate hemophilia, and very severe form. It may interest you to know that majority of the cases we have are severe hemophilia, in which case the factor 8 or 9 activity is less than 1%. That means virtually no factor at all. And so the majority of our patients tends to bleed profusely from very minute or minor injuries. Okay, so once you have these factors available, many of these tertiary institutions have, and where they don't have, we normally will reach out to the Nigerian Federation of Hemophilia with headquarters in Kaduna, where the chairperson resides. I think the headquarters is in Kaduna. So once you reach out to them, they will be able to send some factors, but limited, because they also assess. Remember, I said the factors are available, but through designated means. And one of the designated means we have in the country is through the Nigerian Federation of Hemophilia. These are drugs that are not gotten, usually you are not supposed to get it over the counter because they are very, very expensive. So the Nigerian Federation liaises with the World Federation of Hemophilia, and they get this factor supplied to them through the Nigerian Federation, while the Nigerian Federation now supplies to the sufferers. So it's expected that as soon as you identify an hemophiliac patient, you're supposed to register them with the Nigerian Federation, so as for them to be able to access not just factor, but education, because they have meetings where they educate them on self-care, okay, and how to manage their condition up to adulthood, okay. So there are facilities that are available in the countries, in almost all the teaching hospitals, but there are some designated facilities we call the Hemophilia Treatment Center. Some centers has been
Which
designated.
ones are they? Which are those centers around us? Uh-oh, I think our network we're having a glitch in the network. Just give us a few minutes and we'll get back, we'll reconnect again, okay? This is still Marjorie Bash Health Show, where we discuss health and wellness at its best, and we'll pause for a quick break to get back our network. Okay, welcome back to the Marjorie Bash Health Show. I'm sorry that we've had a network glitch that cost us our guests, but just hold on. We are going to he'll join us again in a short time. And Dr. Ekwere from the University of Uyo Teaching Hospital has been discussing hemophilia, and we've gone through different things from how it presents, who gets it, and why they get it, and then the kind of services that are available in Nigeria for people that have hemophilia. So just so you know, we have a quiz that you can take at the end of this broadcast for you to stand a chance to where you can stand a chance to win free airtime by answering questions about today's show and about hemophilia. You don't need to pay money to take our quiz. It's totally open, and and you can take it just so you get to know more about hemophilia. But I can assure you that if you take the quiz, you will likely, I said likely, but not for sure, qualify to get free airtime from Marjorie Bash Foundation. And one more thing I'd like to mention, though, is that we have an ongoing research about hemophilia. We want to find out what's happening with hemophilia in Nigeria. And this research is aimed at one, understanding the barriers that people face in accessing care, either barriers towards education or treatment or even support. And this research is anchored by Marjorie Bash Foundation in partnership with the Marjorie Bash College of Health and Technology in Aba. You do well to get in touch with us if you're interested. We will pop out the link to the survey on our Facebook page and our social media handles so that you can participate and help us find out more about people that have hemophilia in Nigeria. And then we will also talk about how to help people that have hemophilia in our communities. Again, this is the Marjorie Bash Health Show, where we discuss health and wellness. And our guest today has been Dr. Timothy Ekwere from the University of Uyo Teaching Hospital. And I'm sorry that we've lost Dr. Ekwere, and we've been going on here for about 40 minutes. And it's just about time for us to wrap up the show. But let me just ask, does anyone have any question? You want to pop it in the chat so that we can address your questions. And we'll also be sharing links to resources about hemophilia in Nigeria in the Facebook live video. We'll kind of put it in the chats about things that resources that we have available regarding hemophilia. Welcome back, Dr. Becky Brown. And I don't know, do you have any questions? You want to add, you have any comments about this condition before we wrap it up, Dr. Brown? Okay, I'm afraid Dr. Brown cannot hear me very well. We seem to be having quite a lot of network challenges tonight. But you know what? This is how life is. Some things don't usually go as planned. And we are very happy and delighted that you were able to join us. And if you don't have any further questions, we will be wrapping up the Marjorie Bash Health Show for the November 5 edition. And again, we appreciate everyone who has been part of the show today. We appreciate those who have joined us online and who are sending comments on Facebook and even other chat methods. And again, this show will be hosted again in a few weeks' time. And if you can, try to take our quiz and let us know what other topics you would like to us to discuss in our regular health show. And again, this is Marjorie Bash Health Show, where we discuss health and wellness. Okay, just looking
Just
around and
before
see.
we go on to this, just before we go on to this episode, I would like to say thank you to Dr. Timothy Ekwere, the consultant hematologist at University of Uyo Teaching Hospital, who has made out. Well, once again, apologize for the network glitch, although it's beyond our control, but regardless. So in my short time of practice, I've had one experience with a patient with hemophilia. That was in 2021, around February, yes. So I was working in the special care baby unit. That's where preterms and neonates. Neonates are children between 0 and 28 days are being managed in specialist hospital. So while we were there around 9, 10 p.m. in the night, rushing a baby, and apparently the baby had been circumcised earlier that day, but was bleeding despite dressing and applying pressure and all of that. And so they brought the child um, for us to see and then manage appropriately. So in the course of history taking, we realized that that wasn't only the child that had been affected. Of course, we suspected that it was hemophilia from the history where of the child prolonged the history of prolonged bleeding. But when we took further history, family history, and the likes, we discovered that the older brother, or the older brother to the one that had come that was 8 day old, had similar issues during circumcision, and he bled for, he got better. Well, unfortunately, he lost that baby, or baby, of course, and it to follow up. As with most healthcare facilities have issues with level of education of patients, financial issues, and all that. So once some of these patients come to the hospital, they do not want to stay beyond a certain period because they are financially constrained. And that was the case of this baby and the family. When the immediate issue at that point in time was resolved, they opted to go home. And of course, you can't force them to stay. You can't keep them beyond what they can afford, and so we let them go. That's the last of it. I heard. So I do not know. Well, we also have issues with poor data collection in Nigeria, so I can't tell for sure how many more are living with hemophilia in states where I was as at 2001. So that's just a little bit of the contribution that I wanted to give on the show. Over now to our host, Dr. Kelechi. Thank you.
Well, thank you very much, Dr. Brown, for your thoughts on for sharing us your experience about hemophilia. So this thing is real. It's not just only in our imagination or only at the teaching hospitals. And that's it, ladies and gentlemen, for tonight's show of Marjorie Bash Health Show. We are asking you to continue to live healthy and live well. If you've got any questions about this topic, please shoot an email. And I'd like to remind you that we have a quiz that you can take at the end of this show to let us know what you've learned about hemophilia. And before I go, I'd like to remind everyone that Marjorie Bash College is admitting students into the 2023 and 2024 sessions. We have several programs. One of them is community health, where we teach you how to do things like take deliveries, give birth to babies, or manage common conditions, or even help to identify those that have hemophilia. We also have pharmacy technicians program, where we teach people how to manage medications and support pharmacists in the community. The other program we have is health information management. Dr. Brown talked about lack of data. These people manage health data. They help with managing health records. And it's a beautiful program that we have. That is well accredited. And we also have our medical laboratory technicians program, where we teach you how to make diagnosis, work with different lab tests, and they can work in teaching hospitals when they graduate, or even in private hospitals. Then biomedical engineering. I don't know how many of you have gone to a hospital and they said, the X-ray machine no they work, or this one no they work. Our biomedical engineering program is supported by partners from the UK who have made it possible for us to be able to train people in different areas to be able to manage health equipment. And we have a lot of certificate programs. So you are more than welcome to check out our application form. Just visit our website. It is www.mbashcollege.org, and you'll be happy to find out more about horse. And so, thank you very much, Nonya Doris, for your comment and replying to a question here on our a comment on our Facebook that this thing it happens to do this condition has to do with males mostly. Well, until I see you again, keep staying healthy and keep staying fit. Again, this is Marjorie Bash Health Show. Have a wonderful evening and stay well. Bye-bye.